Welcome to Hashtag Wednesdays Weekly, a weekly information session in collaboration with the voluntary sector and public sector partners. Today's session is Diagnostic Collaborative Networking, how the communities of Greater Manchester will benefit. And our host is Katie. Over to you, Katie.
Thank you. I shall just share my screen and hopefully get the right one. There we go. I'm just going to turn my camera off for the time being while I'm presenting, just so I've got easy access to my notes. It's a bit difficult sometimes to do it. So I'm Katie Moss, I'm the Diagnostic Network Programme Lead. Thank you for inviting me to present at today's session. Most importantly, thank you for joining. I would usually be joined by my Programme Director, who's Chris Slight, but unfortunately he's unable to attend today. So you just have me, but I'm here to present a short presentation on how the communities of Greater Manchester will benefit from the establishment of diagnostic collaborative networks. So I'll just take us on to our next slide. So I'll just give you a summary of what we can expect from today's presentation. I'm just going to cover the following areas. The first one about us and who we work for and what we're looking to achieve. The second is our diagnostic networks and is included within our diagnostic services, within our network and our main members. And then our collaborative successes in terms of what we've been successful to date and what we hope to achieve in the future. Just a brief outline of our future plans and then a summary of the very fast moving programme which is focused on introducing community diagnostic centres throughout NHS systems. So this is the first slide, which is about us. So it'll just give you a bit of context into who we actually work for. So we work for the Greater Manchester Provider Federation Board. This is actually a partnership group which is made up of senior executives from each of the Greater Manchester hospitals.
Sorry, Katie, the slide's not moving. I'm still on the first slide.
Have you seen, is that the agenda one?
No, the very first one, where it says yours and Chris's name.
Apologies, let me just, it's not going well. Is that on now?
Yeah, it's still on the first slide though.
Oh. So about us then, we work for Greater Manchester Provider Federation Board, which is a partnership group that made up of senior executives from each of the Greater Manchester hospitals. The board was established to develop greater collaboration and system working, and it provided a structure for organisations to formalise some of their decision making going forward. And because we're part of the programme team that work for Provider Federation Board, we operate as an independent group, so we've got no allegiances to. Can you hear me? Can you hear me?
Hear you just about, yeah. It's a little bit muffly.
Right, okay. Yeah, so we've got no allegiances to any of the organisations because obviously we're an independent group. So other than the hosting arrangements, which deals with the financial transactions for staff pay, etc., we operate independently. So we are looking to collate the views of all our hospital providers and then establish a collective GM list of priorities for diagnostic services. So what is it that we're actually aiming to achieve with our network? Well, we work to national, regional and local policies. So part of our work is to deliver elements of the long-term plan, the NHS. In addition, we are currently focused on delivering a number of recommendations that were published as part of an independent report on diagnostic services within the NHS. This report was compiled by Sir Mike Richards, who recommended significant change and investment in diagnostic services. And he recommended that we look at different ways of working, understand how technology and digitisation can improve connectivity between the diagnostic services, and address some of the key workforce issues that we've got in terms of recruitment and retention. So these recommendations really are looking to increase and optimise our diagnostics capacity so we can try and improve efficiency. And we want to try and reduce our waiting times and our diagnostic backlog, particularly over due to the pandemic, and improve our patient outcomes. One of the other main recommendations as well for this report was to establish pathology and radiology networks. And all of these things should address the variations in services that we currently see for patient and service users. So what it will mean is that the patient should receive the same quality of services from diagnostic, regardless of where they are in the region. Next slide, please, Laura. So our diagnostic networks, this slide really just gives you a flavour of each hospital across GM, and it just shows you the vastness of our locality. So each hospital has a pathology and radiology service within on its site. So what does that mean in terms of the network, and what am I actually referring to when I talk about a network? So the networks are a way to bring subject matter experts together from each field in these services. So it's radiology and pathology, so that they can share the best practice and work together to improve the services. It also makes sure that these services can review each other's work and make sure everything is equitable and provide best practice across the region. And now that the development of the networks are actually not new to Greater Manchester, there's been previous attempts to work together in this way that haven't been as successful as we would have liked. And part of the problem with that has been actually the pride of the staff within their own organisations, and if you like, the organisational sovereignty that each organisation wishes to maintain. But I think those barriers now are starting to really break down, because as we've seen, if there are any benefits that can be realised out of the pandemic, it's the positive way that the diagnostic services have been supporting each other across Greater Manchester, offering each other mutual aid to make sure the services are maintained throughout that unprecedented time. And it's that sort of working together that we now want to try and build upon and take forward, so that each organisation benefits from working together in a lot more structured way as we move out of the pandemic and into a post-recovery phase. Next slide, please, Laura. So what our success has been with the collaborative network that we've established up to now. So this slide gives you an indication of the work that we've achieved in the short time that we've been established as a network, and how that work has actually impacted on patient and service users. So the first one here, the first column, our network has been the first region in the country to jointly buy a single radiology system. So that means that there's a radiology scans that are shared digitally between hospitals. There's no longer that need to send CDs or films in between sites. It means that the consultant doctors have real-time immediate access to those scans, and patients no longer need to repeat scans when they move between sites, because they're there digitally available to access. And for example, if a doctor has had had difficulties accessing previous scans, they may have asked for a repeat test, and that's no longer needed. And the use of the system enables hospitals to share their workload, so that doctors can actually report from other sites as well, which means that for a patient perspective, their radiology scans are going to be reported on and looked at in a lot more efficient, quicker time than they would have done previously without this system. The second success that we've had is that our region has been successfully awarded national funding to buy some home imaging workstations. which means that we can really do some agile, sort of flexible reporting. So it's important for the patients because pre-pandemic, it was kind of ingrained that working from home, reporting from an off-site location wasn't possible, wasn't feasible. But however, during the pandemic, staff had to work in a way that we could, we had to work from home if we could. And it meant for the first time that radiologists were able to take some of their workstations home and report scans from the comfort of their own home. And you think, well, why is that really a significant benefit for patients? Well, actually, it makes the workforce a lot more flexible for the working practices, and they can actually they can report at a time that suits them. And really, that's sort of a fantastic initiative to be able to advertise to our new workforce that we're looking to recruit into the service. And it also means that some of the existing workforce who may have been looking to retire could actually use these facilities now to continue working at a pace that's suited to them, because they can work from home, don't get interrupted, they can work when the hours that they wish to work, and it benefits the patients in that the turnaround times are a lot quicker. And then the third success that we've had most recently is to do with the implementation of digital pathology across Greater Manchester. So digital pathology is looking at the use of technology to try and digitise diagnosis of biopsies. So the awards that we got from this funding were actually £10 million. And I think it's fair to say that GM were lagging on the digital pathology. A lot of the other systems across the regions were a lot more advanced in implementing digital pathology. So the £10 million that we've been awarded from the national funding will actually support improved cancer diagnosis and allow biopsies to be processed a lot quicker. But it'll also enable the doctor to actually concentrate on more complex cases, because in a way it will sort of filter out some of the negative cases and enable them to really focus their attention onto complex biopsies. And it'll also help with doctors who are looking to try and get a second opinion, because everything's on their computer and it can all be accessed real time. So it means that there's no longer sending slides to different laboratories. The doctor will be able to see it there on screen and to be able to help with second opinions and multi-team disciplinary reviews. Next slide, please, Laura. So in terms of our future plans, our main plan really is to act as a collaborative influencer and system leader. We want to encourage all our hospitals and our wider community services to work together to improve diagnostics across their communities. And in terms of our future plans of what we want to do going forward, in both services, radiology and pathology, we want to standardise our system and processes so that each organisation has the same processes going forward, and then that will filter down to patients in terms of they will receive the same quality of care. In both services, we want to try and introduce artificial intelligence, which a lot of people are a bit worried about. It's not seen to replace any staff at all. It's to the use of artificial intelligence technology is to try and support the staff and the workforce. There are difficulties recruiting into pathology and radiology services, and therefore it'll just provide staff with an ability to use these technologies in a way that will help make their working practices a lot more efficient. The one thing we're doing in pathology is to introduce a reporting system in the laboratories, which means that all the laboratories in Greater Manchester will be linked together. That's currently not the case at the minute. So if you have a sample taken and a GP or another hospital wants to look at that pathology report, it may not always be possible because those systems are not linked together. We also want to try to increase the use of point of care testing for patients, so that diagnostic tests are closer to the patient at a site that's more convenient for them. And then pathology sample tracking and traceability. We currently don't have any systems in pathology services where a patient and other services can actually track a sample. So for example, from GP to hospital to patient, the patient may want to know that the sample has gone from the GP, it's been received at hospital, the hospital site has then processed it and a report has been issued. So we want them to look at the full process map from sample to report. And so our joint plans of how we can actually do this is we want to increase the number of diagnostic staff whilst keeping our existing staff and making sure that they're satisfied within their working lives. And we're hoping to try and seek better value for money in terms of buying our equipment together as a region, and also build on those relationships to reduce sovereignty of local diagnostic services. Next slide, please, Laura. So, community diagnostic centres, this slide is just, it's the final slide in terms of our service, our programmes of work. But community diagnostic centres are a new initiative that's been brought in by the NHS, which are aimed at building capacity for more diagnostic testing in England. And it's first and foremost one of our key network priorities. We need to try and relieve the pressure on hospitals in terms of diagnostic testing. And so these community diagnostic hubs are a way to seek multi-diagnostic facilities that are away from acute site and more in the local communities, where it'd be almost, if you like, a one-stop shop for diagnosis. So we're working alongside our primary care colleagues to plan and deliver these multi-diagnostic facilities. And it means that patients will no longer be referred for multiple appointments for diagnostics. So if you need a blood test, you need a scan, it will all be done in one place prior to you even travelling to a hospital. It will also help to bring diagnostics in the community where there's a high level of deprivation. And what we're seeing is where there's high levels of deprivation across GM, we have a higher level of do not attend for outpatient appointments and diagnostic appointments. So hopefully if we can bring the services closer to the patient, they don't have to travel to the hospital. It means that there's a one-stop shop for the diagnosis. It kind of reduces that postcode lottery inequalities, this access to all of the community. Again, you don't have to have, in terms of patient experience, it's a better patient experience because there's no need for multiple appointments at different locations. Hopefully we can try and build into central placed booking for appointments, so it would be one appointment area that we phone, appointment service to phone to book into. And because there are hospital sites and more to where patients are in the community, there should be better accessibility to those sites. There should be better public transport and parking. And it also, by establishing new community diagnostic centres, there's the opportunity to use new technologies for booking appointments. So we've and actually undertaking consultations. So the virtual appointments that we're seeing a lot of now with our GPs, we may be able to do that from diagnostic centres. And patients hopefully will be able to manage their results and telephone appointments a lot more efficiently. Next slide, please, Lauren. So this is a slide really just to put out there, we need the views of patients and our service users because it is crucial to the success of our programmes. And so we're trying to work with all our public bodies to ensure that what matters most to our communities and how they access their diagnostic services are actually all embedded and brought within the umbrella of our programmes. So for us, we need to make sure that we consider that we do link in with our members and community groups and actively seek out health advocates and any public representatives who'd be willing to engage with some of our plans going forward. and it is a kind of request of what is the best method of informing each other of our work going forward to make sure that we maintain these links now as we work through our different programmes. Next slide, please, Laura. And that's all I have to present on. So, any questions?